Professor Sara Brown, and my job involves two roles really. So a large proportion of the week I work in a genetics lab, and my team is involved with essentially trying to find out how our DNA controls our skin to make us more or less likely to get eczema. And the ultimate aim is to use that understanding of how the DNA strengthens or weakens your skin to define treatments that really target the underlying cause of eczema. And the reason I do this is because the other half of my working week I work for the NHS, caring for patients with eczema, so people of all ages, right from tiny babies up to elderly people. So surface echoes was an idea that I dreamt up quite a long time ago, and it was kind of prompted by my reading a research paper. There was work that other researchers had done, a type of research called qualitative research. And what that is bringing together lots and lots of different people's experiences, people's written records, people's quotes of what it's like living with eczema. So either the patients themselves or the family or the carers telling their story. And I kind of like to think I understand quite a lot about what it's like living with eczema, but still when I read this qualitative research, it was very moving to read again and think and imagine the everyday life experience and the challenges of living with eczema. And then I realised that this goldmine of information was locked away in an academic resource. It's in a research paper that's in the library that you can read, but very few people would read it unless they're academic. So that was the dream, to take the patient and carer experiences of eczema, take it out of the goldmine and make it come alive so that other people can hear the voices and can understand more about what it's living with eczema. The team for Surface Echoes kind of evolved over time, really to do anything as ambitious as to take voices that are written down and locked away in an academic resource, to bring them alive for people to hear in a fresh way, required a lot of skills that I don't have. And probably the most important skill is a very talented artist who I've worked with previously, and that's a lady called Bev Hood. So she works at Edinburgh College of Art, and I'd worked with her previously when she was an artist in residence in my lab. So she came to my lab when I was working in Dundee, and she came and asked all sorts of questions, looked around the lab, learnt a lot about the skin cells that we worked with, and she kind of reimagined the life of a skin cell through the research lab, and she made some really beautiful work out of that to help people that might never get inside a research lab to have some insight into what it was like and what we were trying to do. So I immediately thought Bev would be an amazing person to help with this dream that I had of bringing patient voices alive for more people to hear. And then the other thing we're very keen on in Surface Echoes is that it's not just us deciding what the voices are, it's got to be patients with lived experience that are going to help us co-produce whatever is released into the world to improve people's understanding of eczema. So another key member of the team is a lady called Dee Davison, who works at the Research Institute where I'm at, and her role is public engagement, so making those links between researchers and the general public. So together we then applied for a small pot of money from the University of Edinburgh, a SEED award it was called, to get started, and based on work that we did with a SEED award, we were then able to apply for a bigger pot of funding from the Scottish Public Engagement Network, which is again Wellcome Trust funded, and this time we got a lovely chunk of money to really run with the idea and develop it properly over 3 years. I guess my role in the project is partly motivational, like you can tell I'm really excited about this idea. I also like to, be the person that stays in the background, because I'm very aware that when I meet patients in clinic in my job as a doctor, it's inherently a kind of a formal-ish situation. I try very hard to make people feel comfortable and tell me what they really think about their skin condition and about the treatments that we're using. But there's still an element of formality in that I'm their doctor, I'm their clinician, and they're my patient. And part of the joy about doing public engagement is you get away from that formality and people start to say what they really think. So the last thing I would want in this whole project is for people to to feel that their voices were in any way inhibited by a professor of dermatology being in the room. So for that reason I tend to keep quite a low profile, and I love hearing what people are saying to my colleagues who are really able to get insight into what people are saying. So a real huge challenge with eczema is that it's a disease that goes up and down, and we struggle with that as clinicians because you can see a patient in clinic and the eczema might be relatively well controlled, and even the next day or the next week it could be a totally different story. Suddenly the skin flares up, suddenly it's very difficult to live with, and that we call it relapsing and remitting condition. The fact that it comes and goes so powerfully is challenging for the healthcare system, because we need to have the ability to see patients when they need to be seen, when it's flared up. And if you just give routine follow-up appointments, sometimes people are coming to clinic when they're in quite a good condition, and then sometimes it's harder to squeeze people in to your clinic schedule when actually they most need to be seen. So that's frustrating. The other frustration is really trying to get other doctors and other healthcare professionals to understand that eczema is a disease that has a massive impact on quality of life. It's not just a skin disease, and we struggle with the general population understanding that, but doctors themselves and healthcare professionals in general can sometimes not have a good assessment of how severe the impact is on the patient and their family and their carers. So that's something that I spend quite a lot of time doing, trying to educate fellow healthcare professionals who clearly have to know loads about everything. GPs are overwhelmed with trying to care for so many different conditions. But just making sure that the itchy skin condition that is eczema is there on their radar, that they're aware that our patients suffer enormously. And research studies have shown that in terms of impact on quality of life, having eczema is right up there with the other diseases that doctors conventionally think of as important. So diseases like epilepsy, diabetes, kidney failure. These diseases have a similar impact on quality of life as eczema itself. So it's definitely not just a skin disease, it's not just an irritation, it's something that's well worth a doctor's time. So that's one of the things that I really hope will come out with surface echoes. I'm humbled when my patients tell me about things like children at school who their friends and sometimes their teachers as well think it's an infectious disease. It's not infectious. They think it's caused by either not enough washing or much too much washing. It's not caused by washing. It's not caused by washing powder. Eczema can certainly be worsened by either washing too much or not washing enough, but that's not the cause. Patients say they're ashamed of their skin, which is crazy. Nobody should be ashamed of a medical condition. So these are the things that we struggle with. And as I mentioned previously, even doctors and healthcare professionals can sometimes contribute to the stigma by patients being told it's only eczema, you'll grow out of it, it's only a skin condition. And in some cases, very mild eczema is potentially only a mild irritation, but not everybody has very mild eczema. Patients that suffer with moderate and severe disease can have it for months or years or sometimes their entire life. So imagine that burden of stigma that, over many, many years, it's a real challenge. So one of my hopes for surface echoes is that it can have real impact, that this opportunity to use new ways of communicating, new ways of getting the patient voice out there through the artistic direction and skills that Bev has and the team that we have around her. If you don't live with somebody that's got eczema, if you don't have eczema yourself, it is very difficult to gain that insight, and that's the opportunity that we want to give people. So it's not about lecturing or teaching or correcting people's thoughts, it's more about just allowing people to develop empathy, to get insight, to hear a story that they wouldn't otherwise have heard. And I think really that is the most powerful thing. If you listen to somebody's voice, somebody telling you what it's like to live with eczema, if you have an ounce of interest and empathy, then that is the most powerful way to get around stigma, to help people have understanding, and that's really our hope.